Monday Mythbusters, we're talking nutrition. Does it matter what you eat, or does the baby just take what it needs? Well, one of my clients reported that the head OB at the hospital she was consulting with told her straight up, there's no evidence that what you put in your mouth would affect the outcome of the baby. I'm going to show you two pictures to prove the opposite. Here they are. Number one is a baby born at 35 weeks, one of my babies. We worked on nutrition from week 6 on deeply to help control hypertensive concerns. This woman ate the high protein, high salt, good water diet that I'm going to talk to you about. And this was her baby at 35 weeks at 6 pounds, 8 ounces. How healthy does that feel to you? Here's a baby that we took off of a public forum on the same day. This was borrowed anonymously from a public setting. I appreciate with all respect. And this baby was exactly the same gestational age to the day, 35 weeks, and was born one day later at 4 pounds, 11 ounces. Doesn't that look how 35-weekers usually look? These are the two. Do you think nutrition played any role? The second mom, I don't know her nutrition, but she clearly was getting standard medical care, which doesn't usually include nutritional advice. And she was on a tour of Starbucks with enjoying her coffee tour at the time. So suggestions are there was probably caffeine. I'm guessing not too much attention to nutrition, and it shows in the baby. Can you see the difference? My point is this. Common sense tells me it does. How do you build a house if you never have any supplies delivered to the building site? I know that babies can deplete moms and just take what they need, but when do we get to count the fact that this is the 3rd generation of exposure to Pringles and Doritos, that 3 generations ago, people were not living on fast food and the minerals had not been depleted. There was generational stores of minerals that people were working on. There's a lot of nuance to this. It's not just a soundbite kind of topic, but it's a really big one. I'll tell you that the first 4 pages of scholar.google.com, all, when I put in effects of nutrition on pregnancy, had huge things to say, every one of them talking about the disease risk in later life, the fetal programming of disease, placenta weight and fetal weight, how doctors should be cognizant of the need for maternal nutrition in pregnancy. It's a very big deal. We're talking at least 1 gram of protein a day per pound of ideal body weight of yours. Enough water that gives you about your body weight in ounces, half your body weight in ounces a day in water. And lavish use of salt. See my salt reel if this is shocking to you. We're talking Celtic salt, ideally, Redmond's real salt, secondarily, not Morton's, not Himalayans, lavishly using it on your food, and then adding an extra teaspoon or 2 a day as a health benefit. That's what that baby did. Her blood pressure got more normal the more salt she had. It was a very big deal. I hope this helps. We're going to talk more.